Welcome to the PA Perspective podcast. I'm your host, Mackenzie, and I'm so excited to begin this journey podcasting throughout the medical profession. Okay, so today here I am joined with Sahil. He is part of my cohort, and before we even get started, this episode is on kind of just differentiating the two professions between a nurse practitioner and a PA. It is not to say one is better than the other. It is just to help to differentiate the core values, the different education, so on and so forth. So again, we are not here to compare which one is better. Both professions are amazing. We will be working with both of them. So I just want to start off by that disclaimer, and I guess we'll get in. So do you want to just tell a little bit about yourself, just a quick intro, and then we'll kind of really dive into everything.
Yeah. So again, my name's Sahil. Excited to be on this podcast. I just want to thank Mackenzie again for having me on the podcast. I think I want to give you your flowers because I think what you're doing with this podcast, it's absolutely incredible for the profession. And I think it's important to kind of advocate for a profession. And yeah, I just want to say what you're doing is incredible.
Wasn't expecting that. That's so nice. Thank you. Thank you.
Continuing with your question. So I am a nurse by background. I've been a nurse for the past year and I'm still a nurse. But now I am a current first year PA student. And I'm looking forward to having this conversation.
Perfect. So obviously, yes, that's why I picked you. You come from a nursing background. You're still a nurse, which again, applaud to that. Being able to still work in PA school is amazing. And I think I definitely just wanted to use your perspective and understanding because I think it's so important that you come from that background and you chose the PA path. Not that any path is better than the other, but it's just understanding that I think especially as health science students, I mean, you're different because you were in nursing. I feel there's always one path that people say. Yeah. And it's so important that there's so many paths and you can go from one path to another. You can change. It doesn't have to be exactly 100%. What's thinking. So that's exactly what I want to do this. So again, just here to help give more role clarity. I think I also want to start off by saying I find this topic so interesting because even myself, when I'm describing I'm in PA school or, I'm going to become a PA, I even default, which is potentially something I need to work on, is when someone's oh, what's that? In my head, the quickest way to get the explanation, I'm oh, you know what a nurse practitioner is, right? Yep. Everyone will always say yes, and then I just help to kind of build that background and then differentiate from there. But that in itself is a problem.
Yeah, it's kind of doing injustice to the profession.
100%. Because then it's if I just say, I'm a PA, and then I describe it, I still don't see the click in some people's heads. I'm okay, I feel you're still not understanding. Yeah. And again, this whole thing with the name, people just may be thinking I'm a clerk of some sort or I'm a medical assistant. So I even myself default to that. And I think, again, that's something I need to work on. And I think that's why I want this episode, and just to help really differentiate the whole roles and understanding exactly what these two professionals can do and why they're different. Yeah. Okay. So I think let's just start off walk me through your previous education. Just give me the background on that. Sure. You can talk a little bit about the type of nursing you do now, your interests growing up, all those things, and then just we'll get into how you figured out this path.
Yeah. So I went into nursing straight out of high school. So that was my first undergraduate degree, and I went to Toronto Metropolitan University. I kind of started in the COVID, kind of when COVID was going on in September of 2020. Then I ended up finishing in May of 2024. Mm-hmm. So common question that I always get asked by people and by friends is why I chose to do nursing, mm-hmm. especially being a male. It's definitely something that people ask me a lot, and why I chose it over another undergraduate degree. And for me, it's not just one reason. I think it comes down to a multitude of factors. One of the biggest things for me, however, was my brother was actually a nurse. Okay. And he's 6 years older than me. So growing up, I kind of always looked up to him, and he kind of set the foundation for me growing up. And kind of the steps that he went through, I kind of followed those similar steps. And I always remember still being a kid and hearing him tell me stories of when he was in placement and he saw this patient and he helped that patient and he helped this family. Those were things that were kind of seeded in my brain before making that decision in my grade 11, grade 12 year of high school, which direction I wanted to go through. Because, I contemplated other degrees as well, which I'm sure many other students do currently. So that was a really big reason for me. Another reason was the fact that looking into nursing, I realized that coming out of my 4 years after finishing it, I would have a job, and that was really important to me at the time. Having a secure job, especially with the pandemic going on, it was me realizing the impact that nurses actually had on the healthcare system, because I feel like prior to the pandemic, many people didn't really know what nurses were, including me, even though my brother was in nursing. Seeing what the pandemic did and that impact that had really kind of pushed me, and it aligned with kind of what I wanted to do, because I always had an interest in healthcare. It's just I didn't know which direction to go in. And going through nursing, going through all those 4 years, going through rotations, having that foundational knowledge really kind of, it made me realize that, okay, yes, the decision that I made was the right one for me, because I really enjoyed nursing, and I still enjoy nursing. I currently work part-time, even during PA school, and the only reason I'm still able to do it is because I enjoy it. If you don't enjoy something, there's no way you're going to be able to keep up with it. So I've been working, so like I said, I graduated in May of 2024, and then I started working as a nurse in September of 2024 at Sick Kids. And for the first year, I was full-time. So it was it was a vigorous work schedule. I was kind of going 3-4 days a week, working like over 60 hours, basically a full-time job.
Right.
However, I always knew that I wanted to do more, so I kind of just applied to the PA program. And I wasn't really sure, we'll get into it, but how competitive PA programs are, it's insane. So I wasn't really sure if I was going to get it or not. Luckily, obviously, I did end up thankfully getting in. And then we started this program in September 2025.
I know. And now we're almost like a third of our way in our first year, which is insane.
It's insane. Time
gone by
just
so
flies
quickly.
by.
Okay, before we actually dive in, I think you've brought up so many points that I definitely want to talk about. Mentioning the whole point of being a male nurse. I think that's a huge thing I want to talk about. Just like a quick brief thing, because I think I remember in high school, a bunch of the guys in my group being like, oh yeah, I wanted to go into healthcare, but I don't know if I can become a nurse. It's always a female dominated thing. So I think that's an important thing I want you to talk about. And then also post undergrad job security.
Yeah.
So fair, because I come from a health science background. It's not really something you get to just jump. There are a ton of jobs you can jump into, but if you have always wanted to go into a health science background, you kind of have to have in the background knowing that there's a further master's or there's something else you have to do to get to that job. Yeah. So if you want to just touch on those two things, I know that's a lot, but
sure.
You brought up too many points. And I was that's so good point.
I did bring up a lot.
Good point.
But yeah, starting off with the male perspective, even when I was in high school, making this decision to actually jump into nursing, I still remember telling my friends oh yeah, I'm going to do nursing. And I always had friends look at me, teachers look at me kind of in a certain way. They're like, oh, nursing? Why? It was always a surprising answer to them, because it's, like you said, it is a female dominated profession. But I think I would make the argument now that being a nurse, that I think healthcare in general is a female dominated profession. And I don't think it's not a good or bad thing. I think that's just how the landscape is. Nursing gets more of the attention because that's how it's historically been. But now I feel like after COVID especially, and even when I was in nursing school, my last couple years of nursing school, I noticed more and more male nurses or male students entering the profession. And I do think a big reason for that was the pandemic. And it was probably also due to the lack of knowledge regarding what nurses actually do. I feel like it's something that I still have to explain to people who don't work in healthcare. It's what nurses actually do, what their role is, how they fit into the healthcare system, because oftentimes it's just looked as, oh, they're just the doctor's sidekick. But there's so much more to that. And I think having the nursing background that I have now and being a PA student, it kind of brings everything in a full circle manner. I'm able to kind of see the bigger picture, especially when it comes to being in clinical practice, because I understand two sides of it, right? And I think this goes for anything. I think if you're ever working in a different field and then you were to transition to another field, you automatically will have more respect and more appreciation for that field. I was always okay with even going against like what the stereotypical views of nursing were, like where it's female dominated versus male. Because like when I got into the profession or when I got into school, it was like I was welcomed, and like I made incredible friends. I still have incredible friends, and quite frankly, like the more and more I entered clinical practice and even working as a nurse now, like I work alongside plenty of male nurses, and even working alongside female nurses, my relationships with everyone in the hospital, it's kind of the same. Like it doesn't really change, and I think it's just like a stereotypical barrier that people
100%,
have to get over.
100%. It's like something as a society we've definitely done.
Exactly.
I think the demographics also shift.
Yeah.
I think at some point in medicine, it was probably this dominated. Like, I feel like it's always shifting.
Or certain specialties, certain 100%. Specialties where like surgery is like a class example, male dominated, but we're like seeing females push the envelope. And I think the same thing's kind of happening in nursing, which I don't know, it really makes me happy because now I see new nursing students come in and I'm seeing more male students, and it's like, it makes me really happy because it's like, wow, okay, like we're actually pushing the envelope here.
Yeah, that's what I think about when I think of like ortho. It's like that exact thing, and then it's like, oh my goodness, a female's going into ortho. And it's like, I think, again, the more we push the barriers, hence the whole thing of this podcast, the more we push, the stigmas will come down. The stigmas will come down. But,
100%.
Okay, and then talk a little bit about like, did you potentially choose, and again, this I'm not putting words in your mouth, did you choose maybe that undergrad knowing, like I said, job security? Yeah,
it definitely played a huge role for me. And I will say that it's hard as a high school student. Like you don't know what you exactly want to do. You're kind of still in the exploring state. Like you want to try everything out. You kind of have an idea of what you want to do, but you're not really sure where it's going to go. So you kind of just go into it. Like the classic example is a student who likes science. Like I love science growing up. And initially I thought, I'm going to do a life science degree. I'm going to do a health science degree. And that's what kind of my intention was. But then the more and more I kind of got exposed to nursing through different avenues. Like I was volunteering at the hospital. I was working alongside nurses in that manner. My brother was a nurse. So obviously talking to him, which is a benefit for me. And it's kind of a privilege that I had. So I'm very thankful for that. Just because a lot of high school students especially aren't really aware of what's out there and what path they can go down and what that path leads to. So just going back to your question, the job security, I knew that going into nursing, like I would be guaranteed to have a job, especially with the state of which our healthcare system is in right now, where we're seeing shortages all over the place. Like there's increased staff turnover. So like a job security is something you never have to worry about as a nurse. So it really was like adding to a pros list of making that decision to go down that path. And it mattered to me because coming out of those 4 years, or I'll talk about it a bit more, but like schooling years, I still continue to work. We have positions in the hospital called clinical externs, which are essentially nursing students.
Okay.
And it's a plus because nursing students will get experience, they get some financial income, and at the same time it's supporting nurses in the hospital. So our role, the role of clinical externs is to really just support nurses, kind of alleviate some tasks that like they can focus less time on doing and focus more on critical tasks. So that's kind of what I did throughout my 4 years of nursing school. And after graduating, I was able to get a position right away, just because depending on where you do your placement and like how much you end up liking that placement, you're most likely going to be able to get a job there. So it's definitely a privilege that it's definitely a perk that you have. And it applies to the PA profession as well. But
I think you also bring up another good point. Getting so off track, but it's so interesting is the whole guidance counselor thing. Yeah, now, I have been out of high school for a bit now, so maybe this has changed. But I feel like anytime you wanted to go into like something medical related, like I knew growing up, I knew I wanted to go into medicine. Like if you ask my parents, like I wanted to be like a neurosurgeon at one point. Like I've always wanted to do something in medicine, but it always changed. Like every year I was a different type of surgeon, or I was a nurse. I was something every year. And I think that's what's so hard, and which I love that you said or brought up the point, is like I feel like you're only ever given like you're going to be a nurse or you're going to be a doctor.
Exactly. Yeah.
And then it's like also even for myself, because I always had the standpoint of, okay, I know I want to go into medicine, but I don't know if I want to be a nurse. So then why would I do nursing? But I think I love the point you bring up is like, that's a foundational like undergrad at the same point.
Yeah.
You can either get a job right out of it. You can choose so many different pathways, which we'll get into.
Yeah.
So I think people listening too, if you're in high school, you're trying to figure that out. Like nursing doesn't just mean you have to be there.
Yep.
It's a great foundational education. And I agree, like even when we're in classes, you can just tell the like type of knowledge you have and the experience you have. And we both come from some type of health science background.
Yep.
And like you said, you yourself right now, you're nursing, but you have other plans. So it's like, I think that's so important to like understand that like doesn't just mean you're like stuck in one position.
Yeah.
You know what
100%.
I mean?
And going back to your point, like the question that you're asking me, like what exactly made you go into nursing? And job security, yes, like we talked about it, but the other aspect was like the amount of opportunities that you have. It's almost overwhelming with how many opportunities you have available to you. There's so many different routes that you can go through, and we'll get into it a bit more. But it's never just like you go into nursing and that's the end point. That's it. You're done. You're a nurse. Mm-hmm. There's so many other paths that you can go through, and like you mentioned, like everyone just thinks of it when you're in high school. It's either you're going to become a doctor or a nurse, and we kind of this kind of goes back to this is another topic going back to like our school system. It's like at least when I was in high school, I don't feel like I was exposed to all of these different professions in the hospital. There's so many different professions in the hospital, and I was only able to realize that by working in the hospital, right?
100%. I feel like even in undergrad, like I feel like a lot of, I don't even want to put the word niche around them, but like a lot of the other type of allied healthcare professionals, like SLPs, OTs, PT, all the other ones, again, like it's like, that's never advertised. It's never advertised. And then it just shunts out options even more. Because I agree, like, had I maybe heard about this profession a little bit earlier, I don't want to say I would have done things differently, but maybe, I would have scoped out things a little differently. Nursing probably would have been on my radar even more because I agree, like, you learn and get exposure right off the bat. And I didn't have that in my undergrad. Yeah. But yeah, okay. I guess let's get into it. So you're in nursing school. Yep. You're like figuring it all out, figuring out your interests, your specialties. Like how, when it came to graduation, I know you worked for a year, but did you always knew you were going to do something after nursing school, like beyond just like nursing? Did you always know you're going to take another step?
Yeah. So going through nursing school, I always knew, like from the moment I entered clinical practice, I knew that I wanted to do more just because I knew nursing wasn't going to be enough for me from a point of like medical education. That's something that's kind of from the core of it. That's what I really love. Like learning the medicine is something that I've always enjoyed, like from being a science student in high school to even in nursing, where like I found myself in nursing school going down rabbit holes on the medicine itself, even though that's not what the focus of the topic was per se. So I knew that I wanted to do more. And then being in clinical practice, I realized that as a nurse, I'm limited just by my scope of practice. Like there's different specialties where nurses have an abundant scope of practice, like ICU and emergency. However, there's other areas where there's less scope of practice. And even at the end of the day, like you're still limited because you're not making all the decisions by yourself. It's the medical team. So the MDs, NPs, the PAs, they ultimately are making the decisions on behalf of the patient. And I knew from being a nurse right now, I knew that I wanted to have a bit more responsibilities. I wanted to have a bit more autonomy. I wanted to have more decision-making capability. I wanted to be able to determine the direction in which patient care was going, because even like currently I'm working and I find that there's some times where like my opinion disagrees with kind of what the medical team wants to do, or not even disagrees, but sometimes I'm curious as to why we chose to go down one certain path rather than another path. Like, why do we choose to order this medication and not that medication? Why do we choose to order this test but not that test? And I found myself always asking these questions, and I just knew that like if I just stayed in nursing, I don't think I ever would have been fulfilled. Mm-hmm. And that's what was a tipping point for me. It's as much as I love nursing, I knew that I wanted to do more, and I wanted to gain more knowledge, more clinical skills, more autonomy, more responsibility. I wanted that. And I'm also a type of person who I can't kind of stay in the same place. I need to be doing more and more and more. That's just kind of how my brain works. And I love challenges. I love like pushing myself. I love trying new things. So that's what really was going through my head when I was in nursing, like when I was working for a nurse for full time for the past year.
And I think it's important too to even say, like, I think it's important to, like, when you're looking at those reflections, do self-reflections. Yeah. Because there could be someone nursing right now, thriving, loving, and like that's what they want. Yep. So I think also it's important to realize, not put too much pressure on it too, because if that's your end goal, that's what you're looking for, then that's all that's needed. So like, I think that's the beauty of medicine, though.
That's the beauty of it.
Right? Like, there's so many avenues. You can continue things. You cannot. You can, again, I like how you're saying, like, I'm the same way. I chose this profession because I like to know a lot of things. I like to be good at a lot of things.
Yeah.
Like, in the first episode, I talked a lot about, like, potentially why I didn't go to med school, because that's just not, like, what was for me.
Yep.
But again, it's the same thing. Doesn't mean that's not for someone else. So I think it's important, too, as listening, like, in medicine, you need to be selfish when it comes to your choices. I think it's so easy to hop onto a bandwagon. 100%. Like, so many people who I went to school with, like, I'm going to med school. Yeah. And that kind of stressed me out a little bit, because I was like, I don't know if that's for me, though, and I didn't know what was for me. So I think at the same time, it's like, really reflect on yourself. What are your values, and what do you want to do, in your future? Do you want something that's stable? Do you want something that doesn't really change in a way, and like your role will stay the same? Yep. Do you want something that's always challenging you? Like, those environments can be scary for some, and some people can thrive in them. So I think my biggest advice, or what I could tell my younger self when trying to figure out what I was going into, is like, what do I value?
Yep.
What are my values? Do I value teamwork? Do I not? Yep. Do I want full autonomy? Do I not? Yep. And I think that is a huge thing of this topic, is like, that is the big difference between a PA and an NP.
Yep.
But, okay, we'll get into that. So yeah, I guess I'm going to probe the question, like, you're a nurse.
Yep.
The obvious question is, why not NP?
Yep.
And again, not in a way of like bashing anything, just like in your thought, I don't know what it'd be like being a nursing student, probably being told a lot of the times, like, hey, you can also become an NP after so many years, and then you picking PA. Like, how did you turn to PA?
Yeah. So that question I've been asked, like, I can't even count the number of times I've been asked that question, especially being a nurse and like having to tell some of my colleagues that, hey, I'm going into PA school now. And some of them not knowing what PA is, some of them asking me why not NP. So I get this question very commonly. And like you said, like, we're not trying to, the purpose of this podcast is not to like bash one profession over the other. Like, the end of the day, both professions are amazing, and the end goal of both professions is the same. It's about patient care. Yeah. It's just, and you talked about it, you touched upon it earlier. It comes down to what you prioritize, what you value, and where you see yourself going in terms of, like, from a career standpoint. So for me, choosing PA versus NP, it came down to a few different things. And well, I think the first thing is that I couldn't go into NP school even if I wanted to, because a prerequisite for entering NP school is you need to be working as a nurse full-time for 2 years.
Right.
That's the minimum. And most people who actually end up getting into NP school have years and years of clinical experience as a nurse. So it makes it a bit more difficult. I knew that I wanted to do school rather earlier rather than later. So the PA profession worked out from that perspective, in the sense that I didn't have to, I could just apply right away. Right. I didn't have to wait an X amount of years. The other point of it is we'll get into it, but the lateral mobility of a PA. It's so unique to the profession, and it's something that you don't have to the same extent as an NP. Because a lot of people, or many listeners, may not be aware of this, but when you go down the NP route, there's different areas in which you specialize in. So when you join a program, there's 3 primary programs. There's a primary healthcare practitioner program, there is an adult nurse practitioner program, and then there's a pediatric nurse practitioner program. So depending on which program you go into, you're going to be focusing on different aspects of healthcare, right?
Okay, see, I didn't even know this.
Yeah. It's not a lot of people are aware of it, but yeah. So like, if you go down the pediatric way, you can only do pediatrics.
Okay.
If you go down the adult way, you can only pursue adult medicine. And then the family is like primary care.
Right.
And you
have to choose that before,
You
obviously.
choose, when you're applying to the program. So it's not something you choose when you're in the program. These are different programs in themselves.
Okay.
Yeah.
See, so
you
like
apply
right
to
there,
them.
that's one thing.
Yeah.
I feel like the whole time we're just going to go back and forth and continue to compare, like that right there. Like you kind of have to figure out what you like and what you want to do.
Yep.
And then you're kind of put into that path or bucket even before school started. So
Even
that right there is a huge difference, because in PA school, you learn everything. You're like technically a generalist.
Yep.
You rotate through everything.
Yep. And
And then the whole point is at the very end, you'll kind of figure out what you want, and then you go into it, and then you get like potentially more training when you get to the actual job site. So I think that's a really important part as a whole, is like the idea that in PA school, you kind of get to figure out what you like when you're in that position.
Yep.
Because like I came in, I like 100 things. I can't wait for clerkship, rotation. I can't wait to find something that I like, or 2 or 3. There's a few things you can talk, which will go there. Okay, but keep going. I like that. I didn't know that it's like a distinction right off the bat.
And like you're just talking about, like with PA, you can, since we are trained as generalists, you can work in any specialty you want. You can work in one specialty and another specialty at the same time. You can work in one specialty for X number of years and then switch to another specialty. So there's so many different opportunities. And for me, that was really important, because I knew there's some specialties that I really gravitate towards. Pediatrics, of course, emergency medicine. Those are the 2 biggest ones. But I kind of always think about it in terms of like future. Am I always going to like these specialties when I'm 30, when I'm 40, when I'm 50, right? That's something that I always ask myself, and it may change over time. So having the ability to switch between different specialties, like if I wanted to work in emergency medicine in my 20s and working shift work, I'm able to do that. But then by the time I get to my 30s or 40s, where I don't really want to be doing shift work anymore, like it's exhausting, right? I can switch to outpatient care, which is, it's a beauty of the profession. And this is also something that kind of goes back to nursing, where you have that capability in nursing to do as a registered nurse, right? I just want to clarify that. As an NP, it looks a little differently, because you're kind of put into these different buckets as to what you can do. But that's the biggest perk, and that's something I valued a lot.
Yeah, I fully agree. And again, I think it's so interesting. Like, I definitely didn't even know that in my undergrad. So then had I gone into nursing and then realized, like, wait, if I want to continue, there are those like kind of like buckets you get put into. I think that's so interesting. But again, like there's still opportunity for both professions. Like I'm sure there's still opportunity there to still be flexible. Like you said, you're just going by kind of like demographic wise. Yeah. There's still so much flexibility in that. Do you want to talk a little bit about like the differences in like our education models, if that makes sense? Yeah.
That's another point that I was going to bring up. A reason why I chose PA was, like I already mentioned earlier, like I really love learning the medicine. That's like when it comes down to the core of it, that's what I really love. And I knew I was going to get that by entering the PA profession and entering PA education, because our program is, because most people in our program just have a science degree, and not a lot of people come from a healthcare background. The program is so heavy from that perspective, where we're exposed to so much content from a medical standpoint, and we go through so many different trainings. Like we have a clinical skills lab, we go through medical communications, we have exposure to standardized patients. I've talked to a lot of NPs and current NP students, some of which are my friends, and they don't have that same kind of intensity from the standpoint of like the medicine itself. So the biggest thing is that we're trained under the medical model, and NPs are trained under the nursing model. And it's the same model that RNs are trained under. However, the differences between the two, yes, the medical model focuses on the medicine. I don't think that's entirely true, because if you look at our program, we don't just focus on the medicine. Like we have so many different aspects of our program where we talk about social issues. We talk about social determinants of health. We talk about legal issues, ethical issues. So our program does a really good job at integrating it. I can't speak for other programs, and I can't speak for all NP programs, but from most people that I've talked to, the NP program doesn't focus as much on the actual medical content, because the assumption is that you're a nurse who has years of clinical experience, so you have a lot of the education and a lot of the knowledge. So they don't have to go into the same intensity as we do. So as a result, more of their model is focused on the biopsychosocial aspects. So they look at, the model is all about looking at the patient more holistically, focusing on other aspects beyond just the disease itself. I would say that our program does a good job at that as well. So
yeah, I think that's a good point too, because it's like, I think again that stigma along it, because we technically fall under like the physician model, like we fall under that medical model, and then an NP falls under the nursing model, which is that like holistic patient care aspect, and we're supposed to be like that medicine aspect. And I think it also makes sense though that in NP school they probably wouldn't focus too much on that, because again, you are coming from all that experience, you do have all that knowledge. So I could assume, or I could picture someone in your position, like if you're good with that, NP's perfect for you then, because it's like, I already have this experience. I just want to get this. I just want to like get this next step done, more autonomy, more responsibility, so on and so forth. Whereas maybe you're in a position where you kind of want to dive a little bit deeper into the medicine. Yeah. And I agree. I think our program, and again, speaking just from our program, does a great job balancing it all. Like I, in my head, bias, think it is a holistic way. Like I think we balance, like you said, all like medical communication to then the medicine aspect as a whole. But I think again, just having those slight distinctions of like, it does make sense why the NP schooling is the way it is, because you are coming from a ton of experience, a ton of past education. And again, you have those 4 years of nursing school. So it does make sense. So I think it's just trying to figure out exactly when you take the next step, what type of education do you want to go into? Again, at the end of the day, both are fantastic. Both make great healthcare providers. Yep. I think it's just seeing, again, technically the models we fall under. Yep. But I agree. I'm sure both are pretty holistic in a whole.
We try to, I think the models are there and we learn it in a way where it's black or white. But I think in real life, like what you actually go through in terms of education, it kind of all blends in together. And I think programs nowadays, they do a better job at incorporating both aspects, where it's not just we focus on the medicine itself. We learn about all of the other things also involved, that all of the other things that can also affect patient care. So
I think a lot of the confusion between an NP and PA is honestly just like deeply rooted in how it all started, and we've like stuck to a society of not being able to like understand. Agreed. Like even that nursing model, I'm sure an NP is going to sit there and be like, no, like what I give, the practice I have, the education I have, it's not just that. I have a ton of medical education. So again, I think it's just we're so stuck in those stigmas of like what these models started as. But like everything, especially medicine, it evolves, and the schooling has evolved a ton. So like I think that's just like maybe the misleading conception we've had just of how it's been rooted in us. But I agree. I think they have different models, but I think a lot of the education is probably quite
100%.
The end goals are quite similar.
End goals are, they're definitely similar. And you can see it when you're in practice alongside fantastic NPs, and they're very knowledgeable and they know exactly what they're doing. So it's not like they just focus on the psychosocial aspects. They also learn the medicine. I think my reasoning for just like entering PA school was like, we just get a bigger focus on it, just because the assumption is that we don't have prior healthcare 100%. Experience. So inevitably the programs have to do that. Whereas NP programs, they don't, because you have nurses who have loads of clinical experience and throughout different specialties, right? You could have a nurse who's worked in emergency medicine for like 4 years. You could have another nurse who's worked in obstetrics and gynecology. Like there's so many different levels of education that nurses may have prior to entering NP education.
Yeah. And again, I think it just circles back to like self-reflection. Where do you see yourself? What do you want? What kind of education you want? Because they are different, but again, the end goals are so similar that's why we kind of have to talk about them to help to differentiate them. Because again, like I don't want to have to introduce myself and then have to say, oh, do you know what a nurse practitioner is? Again, a flaw in myself. I should have a more standardized way of saying it. But as a society, we do need to like break the professions apart a little bit just to understand role clarity. And that's something as a PA we face, that our role clarity is not the best. But again, that is something we are working for, and that is something we are definitely like advocating for. Another distinction, can we talk a little bit about like autonomy?
Yeah.
And how that looks?
Yeah. So everyone has this question, and I think people who are in undergrad, they don't fully understand what the difference is between APA and NP. I'm sure that like when I was an undergrad and even working as a nurse, I didn't fully understand what the difference was. And like you said, like you commonly, when you're introducing a profession, you commonly say, do you understand what NP is? And then you try to compare, you try to loop in what the PA is into that sentence. But I guess to break it down as simply as possible, NPs are independent practitioners, right? PAs are not independent practitioners because we fall under our supervising physician. However, that does not mean that we don't have autonomy. We have a lot of autonomy, and our scope of practice is highly, highly variable depending on the specialty that you work in. And it's always determined by either the institution or the supervising physician in which you fall under. NPs also have great autonomy, and because they're independent practitioners, but it depends on which setting that they work in. So the NPs can work in a variety of settings, just like PAs can. They can work in inpatient in the hospital. They can work in outpatient. And there's different outpatient settings that they can work in. They can work alongside physicians. They can work in family health teams. They can also work in, Ontario has something specific called NP-led clinics, so which are just run by NPs in themselves. They have a highly variable scope of practice as well, depending on which setting that they work in. Sometimes they're not able to practice to their full scope of practice because of the institution, because of limitations of the institution, because of limitations by the physician who may be overseeing their practice. So it is variable, and it kind of, like, I guess the cleanest answer is that it depends on which setting that the person is working in.
The key answer depends. Right?
Oh, classic answer.
What an answer. Yeah, I agree. I actually, like, preparing for this episode, I was kind of like looking up, because I don't know, like, I was always told like nurse practitioners had autonomy. They're a practitioner. It's kind of in the word. And I always knew a PA doesn't, but I actually took from the CPSO, because we just got regulated about a year ago, actually, under the College of Physicians and Surgeons. And that's important to note too, that's our distinction too, that we're in separate colleges as a whole.
Yes. We're under CPSO. Nurse practitioners, just like RNs, are under the CNO, College of Nurses.
Yeah, so like that in itself is an important distinction. We are regulated under separate colleges. That's like not a huge fact. Like, it's not like a big detail, because it doesn't change a ton of things. It's just the idea that we are totally separate. CPSO said that the scope of practice will reflect their supervising physician's scope of practice. It's determined by the PA's knowledge, skill, and judgment, and it varies based upon training, specialty, and experience. And I think that was a good way to kind of state it, because it does change. It can look different. And if that is something someone doesn't like, then that might not be a reason why you're not stepping into this profession. Yep. I think that's something to understand. There are barriers to everything. And if that's something you don't want, then maybe this profession isn't for you. Yep. I said in my first episode, and I'll say it again, I stepped into this. I'm a team. I like working in a team. Yep. Especially in healthcare, it gets complex. It gets busy. Who wouldn't want to have a team that you can reflect on and understand, I don't know what's going on, help me. Yep. I think it also takes a lot to say that my expertise does hit a line. I will continue to try my best, and I'll continue to learn as we do in this profession, but my expertise will halt. And the beauty of a PA profession is you are put into a team where you then turn to the next person, an SLP, an OT, a PT. I look to you and I pull on you. And I think that's the beauty of it, and that's what I like. Now, if that's something and I'm not saying that in other professions you don't always work in a healthcare team, but it's the idea of what a PA does. We are based in a healthcare setting. We are based in a team. We have a supervising physician, and then we are told to always lean on our other allied healthcare practitioners, and I think that's just something a little different. Again, I know nurse practitioners do work in team-based settings. They work in healthcare centers. I think it's just the idea that they are a standalone practitioner as a whole. Yeah. And I think that's something that, again, self-reflection, what do you want? If you want full autonomy, then maybe NP is for you. If that's something you're looking for, maybe that's for you. If you're looking for more of that like lateral mobility, I want to lean on my supervising physician, I always want to have all these people around me collaborating, maybe then that's for you. So I think it's just try to figure out what you want and the environment you see yourself working in.
Yep.
Okay, so just as we're transitioning in this episode, I just wanted to shout out if there's any nurse practitioners out there listening who would be interested in being on the podcast, sharing your insights, your perspective, your kind of beliefs on the conversation we're having. Again, this is a student spotlight, so we're both students and are definitely looking to grow and learn from any nurse practitioners out there.
Just to transition a little bit, I think I wanted to get into, again, even growing up, when I went to a clinic, I knew I saw either like a doctor or I saw an NP. I feel like that's maybe where I was exposed a lot to what an NP was, is like, yeah, if I got sick and I went to like the corner clinic, I could potentially see an NP or PA. And I think that's probably what stems from the idea of potentially not many people recognizing the PA role as a whole. I think NPs have had that position for a long time. They're kind of associated with that more like longer term, like healthcare setting, like a family practice or a clinic. People have always had those interactions face to face with those nurse practitioners in a continuing fashion. And I think maybe that's where PAs, we are newer, and I think we naturally have set into positions that are a bit more of an acute setting. Now, yes, there's tons of like general practicing PAs in family medicine right now, of course, but I think maybe that's where, as the general public or just a listener, if you didn't really know what a PA is, it's probably because you haven't always got to have that interaction of just going into a walk-in clinic and them being like, yeah, I'm a PA. It's not that common. Again, we're growing, we're continuing, we're pushing for that. But I think that's kind of where maybe some of the role clarity comes from, is people not being able to interact continuingly with a PA. You might be introduced to them in an ED, they're helping you out, and then you're on their way. And maybe that was your only interaction with a PA if you have had one.
I agree. And like in that setting, you may not even fully understand what a PA is, because if you see a provider for a short period of time and they tell you, hey, I'm a PA, I'm going to be looking after you today. Sometimes when you're a patient, you don't even question that, and you're just like, you just go along with it, and then you go about your way, and then you realize like, oh, I don't even know what a PA is. What was that? What was the thing that person mentioned to me?
Yeah, great point. I just don't even know if in the beginning we had enough time to continue to like clarify our role in the settings we were working in. Again, that's the goal. We're trying to change that. We're trying to grow. And again, I do think as a society, people are starting to catch on from the general public what a PA is. I just think we need to talk more about it. We need to educate more about it. And we do need to get better at our pitches, me and myself and I. Like, I do need to start removing that and just start educating exactly what it is without having to make that connection. But again, there is a connection to it in a way. We are compared quite often. Like, there's your physician, and then there's an NPPA, and then there's nursings. Like, we are quite compared in that level. So I'm sure there will always be that comparison. And again, they are our colleagues. They are people we work side by side with. So that comparison is fair. I think it's just the idea of making sure that we properly define them so that the roles don't get confused.
Agree.
And that's what this goal is. Maybe our last little talking point, I think, maybe not so interesting to someone just listening, but maybe trying to talk a little bit about billing and like how that looks like being a PA versus an NP.
Sure. Yeah. So that's this kind of has been in the works for a while now. Some of the listeners might be aware, but last year, Ontario kind of made the announcement that starting in 2026, NPs would have a OHIP number and they would be allowed to bill. That's kind of what the plan was. And the reason behind that is because we kind of talked about the settings in which NPs can work in. Some NPs are able to have private practices, and as a result, they're able to charge a fee-for-service model. The province does not like NPs doing that because we don't want patients to be paying out of pocket for healthcare that they could receive from a physician or another provider for free, essentially. So the reason for allowing NPs to be able to bill is so you kind of eliminate that. However, recently Ontario made an announcement that it was supposed to happen in April of 2026. However, it's not going to happen, and it probably will not happen if it's going to happen until 2027. So in those settings, so the way that NPs are paid right now, it's salaried. However, there are some NPs that charge a fee-for-service model, and the future is looking at getting them to have a OHIP number and having them bill for different services, similar to the way that MDs are able to. PAs, on the other hand, we don't have an OHIP number because we fall under our supervising physician, and we're not able to bill for services, and we're paid by the institution through funding, either from a group of medical practice like MDs or from a sole MD. So the way that we're paid, it's highly variable depending on the setting that you're working in, but it's also salaried, similar to the way NPs are.
Yeah, and I think the distinction too, the whole point is as a PA, you do not bill separately. So you yourself is not seeing a patient and then being billed from that. That's either from, like you said, your institution or your physician. Again, those are just nuances. At the end of the day, it's not like a breaking factor between the professions. I think it's just another important distinction to make, that like even our billing is separate. Everything is different. So again, the goal is just to describe like we are different professions, though we work in similar scopes, similar specialties, just helping to give more clarity to what a PA is and that we are something different from what a nurse practitioner is. I think to kind of finish it off, kind of what I like doing, probing a little question. Say I was a patient, I was coming in, I'm seeing my nurse practitioner, and then I walk in and you introduce yourself. And I'm like, where's my nurse practitioner?
Yeah.
Why am I seeing a PA? I don't get it. I'm supposed to be seeing my nurse practitioner.
Yeah.
How would you respond to that? What would you do? Talk about it.
So, I mean, first of all, the first thing I would do is explain to the patient that I'm seeing what a PA is. I would explain that PA stands for physician assistant, and the assistant part of it is a misnomer because I think it comes across as a clinical assistant. However, I would explain that we are highly, highly specialized providers who are able to provide a multitude of different aspects of care, including being able to diagnose, being able to order tests, being able to prescribe treatments. I would explain that we do fall under a supervising physician. However, we also have a great scope of practice and autonomy. And if the patient is still kind of confused between between the differences of an NP versus a PA, I would explain that we go through 2 years of education, whereas NPs are existing nurses who have undergone further education to advance their skills. However, PAs are not, they don't necessarily have to be nurses by background. They could come from multitude of different areas. I think that's probably one of the simplest ways to explain it to a patient in terms of what the difference is.
Mm-hmm. And I think it's important even as a future PA to understand like it will happen and just you can't get frustrated in it because it's inevitable. They are confusing. If I wasn't a PA student, I'd probably be asking the same thing. Like it sounds the same, it looks the same, you can do the same things. Yeah. Why even is there two different roles or like titles? I totally get it. And again, I think it's important to understand as a PA, you have that supervising physician to lean on. You have them to understand that we are part of this team, which is, I think, the beauty in it. I feel like that kind of sums up everything we wanted to talk about. Again, just here to compare it, give some more role clarity and help to differentiate that we have different education, different regulation. We're part of a whole different type of college, billing, autonomy, everything. We are very different. Yes, we provide very similar care in certain settings, but our backgrounds are very different, and that's the beauty in it. I appreciate you so much for sharing because, again, I think as these PA cohorts are growing, we're in the 50s right now. They started off quite small. You're probably some of the only or some of the few that have come from a nursing background, the whole circle. Like, I won't be able to say that. Your experience, you understanding that relationship between potentially the nurses you're working with and, like, you know what they're going through. You know the stigma around all of that and so on and so forth. So I think you'll be able to provide such, like, holistic care when it comes to just even working with your team, which is such a value to have. And I think you got to give yourself some props for that to be able to take that leap. And, yeah, so happy you're here. Appreciate you so much. I think that's everything I wanted to talk about. Again, we are trying to break down barriers one voice at a time, and shout out to Lions New Media Center for production.